Hello, my name is Justine Chinn, and I'm a general surgery resident at Stanford University. Today, I'll be presenting our work on the timing of anti-obesity medications in adolescent metabolic and bariatric surgery. Obesity continues to rise in the pediatric population, making both bariatric surgery and anti-obesity medications important treatment options. Bariatric surgery works through several mechanisms, including the increased secretion of GLP-1 RA. GLP-1 receptor agonists, or GLP-1 RA, have been recently approved for treatment of adolescent obesity, though their relationship on weight loss after surgery remains unknown. The objective of this study was to assess the impact of these preoperative anti-obesity medications on the weight loss outcomes of adolescent patients undergoing laparoscopic sleeve gastrectomy. After IRB approval, a retrospective review was performed at a single children's hospital. Patients taking a GLP-1 RA and patients taking topiramate in the 1 year prior to sleeve gastrectomy were compared to patients who took no anti-obesity medications prior to surgery. Demographics and comorbidities were compared between groups, as well as body mass index, or BMI, and weight at consultation, time of surgery, and at 1, 3, 6, and 12 months postoperatively. Percent total body weight loss and percent BMI reduction were compared. Analysis was performed using Kruskal-Wallis rank sum and Fisher's exact tests. Continuous variables were reported in means. An analysis was performed comparing 103 patients on no anti-obesity medications to 14 patients taking a preoperative GLP-1 RA and 18 taking topiramate. The average age was 16.2 years in the GLP-1 RA patients and 17 years in the control and topiramate groups. There is no difference in demographics or comorbidities, including prediabetes, diabetes, hypertension, hepatic steatosis, or obstructive sleep apnea. There is no difference in first clinic weight or BMI, with an average BMI of 46 to 48, and an average weight of 125 to 131 kilograms, or day of surgery weight or BMI. There is no significant difference in weight loss from consultation to surgery between groups, with a 4 to 7% total body weight gained from consultation to surgery on average. However, at 3, 6, and 12 months postoperatively, patients taking preoperative GLP-1 RA or topiramate lost significantly less weight than controls, as you can see in this table on the bottom right. When comparing each medication individually to the control group, BMI reduction was significantly lower in the GLP-1 RA group at 6 and 12 months, and the topiramate group at 3, 6, and 12 months. As you can see, at 12 months postoperatively, weight loss for those not on medications was an average of 25% BMI reduction compared to 18% BMI reduction for those on GLP-1 RA and 19% for those on topiramate. Given that next generation GLP-1 receptor agonists have been recently approved for adolescent patients, their influence on surgical outcomes remains unclear. For both medications, we found that there was no significant difference in weight loss from consultation to surgery, and that postoperatively, these patients lost less weight. This study is limited as a retrospective review and variability in treatment dosages and lengths. While these medications have a role in the treatment of obesity, more research must be done to determine optimal timing in relation to surgery. Thank you so much for your time.